Hi, everyone. We are going to be talking about your health over 40 today. So my name is Abby Horton, and I am a registered nurse, a certified health and life coach, a Wellbeing ambassador, and a wellness class educator. I also teach here at UA at the Capstone College of Nursing. So it's a pleasure to be with you all today and talk to you about your health over 40. Although any age is welcome, you don't have to just be approaching your 40s or in your 40s to benefit from today's class. And I have my contact information here for you. It's Abby.Horton at ua.edu. So if you have any questions or want to reach out after class, you have that information, and I would look forward to hearing from you. So today we're going to talk about common health concerns for individuals over the age of 40. We're also going to talk about important health screenings, and we're going to talk about useful strategies for weight loss and health management for people who are over the age of 40 so that you can be equipped with personalized feedback about some changes that happen when we approach that kind of mid-life aspect. So there are some certain, health concerns that can come up and different things that you might need to do differently. So we'll talk about those, and then we'll talk about how to stay fit for your healthy lifestyle. So here are some common health concerns. We can think about, chronic pain and arthritis. Back pain is the most common type of pain that we see. You can have tendonitis, joint health, stress, heart health, of course, is a concern, and then long-term or chronic inflammation. And I'm just hitting some highlights. We can see some hormonal changes that really impact us during that midlife time. Our blood sugar can, start to be a little bit of a concern for us. We can have an increase in our body mass index or our BMI, and it can be hard to lose those extra pounds, especially around our midsections. We can have changes in our skin or our hearing and our vision, and then we certainly can have lifestyle changes and mental health concerns that start to pop up in our 40s. And so I think it's important to highlight these. Of course, these are things that can be a concern at any age. And so if you aren't experiencing these, that's great. We're going to talk about some other things too, but I want to just make sure that, we hit the highlights of the health and wellness aspect of the class, and then we're going to talk about lifestyle and mental health changes and some fun things to start thinking about, kind of a bucket list of items that you can start to, really pursue as you are in your midlife time frame. So when we think about midlife, a lot of times when you hear 40s, we think that that is not such a fun thing. People will, kind of eye roll or kind of moan and groan and like, oh, I'm approaching 40, it's the big 4-0. And people will talk about, kind of being over the hill or midlife crisis or things like that. There's really a negative connotation with saying that you're in your 40s or approaching 40. It can be really difficult for some people. Others really look forward to it. They feel like they're coming into their kind of own, power, and they're really excited, but some of us are more hesitant. And so I think it's fun to look at what Dr. Brene Brown, well-known social worker, says about midlife. And she talks about here, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt. And this is from an article that she wrote on midlife and, what we really are tasked with at midlife. And so she says midlife is not a crisis, but midlife is an unraveling. And so I think that's really a neat framework to think about our health, because when we're on a health journey, it can definitely feel like we're having to take apart old habits to build back new ones and to build a new foundation. And so pausing and reflecting and resetting can be so helpful for any age, and especially in the context of, COVID-19 and lots of our daily, activities and kind of our routines and structure aren't supporting us as much as we were, before March. It can be difficult to really think about, how do we make these healthy changes? What do I want my life to look like? What do I want the rest of my year to look like? And how do I take care of my health really well? And so I wanted to really update this presentation to reflect what's going on in our world and to acknowledge that if you're having a difficult time or challenges, or you feel a little more, emotional or easily upset by, things that would normally not upset you, it's probably just because you're overwhelmed with everything that you're trying to process. And so I hope this class is a good moment for you to pause and reflect and reset. And we're going to talk about how to do that because that's the fun part. So we're going to talk about screening and prevention first. So the key to healthy living really is to prevent things before they happen. And so we have great resources as employees of the University of Alabama with our health insurance and our benefits. And so we want you to take advantage of those. Well-Alabama screenings are an amazing tool for us. And so you can look at your heart health, cholesterol, your blood sugar or blood glucose. We can look at your health risk and blood pressure and triglycerides and calculate your BMI and your activity levels and give you some really good feedback on where you are in terms of your health based on those numbers. And so it's important to know your numbers to be able to know whether you're making improvements or whether you need to make some adjustments. And so a Well-Alabama screening is a great tool for that. Also, we want to make sure that you're having your annual physical exam recommendations that are, something that you can talk to your provider, whether it's, a medical doctor or whether it's a nurse practitioner. You can talk to them about routine physical exams that might be important for you or lab testing that might be important for you based on your medical history and your family health history. And so we recommend things like, routine medical screens for issues that may come up, assessing your risk for future medical problems, encouraging a healthy lifestyle, updating your immunizations, and then building a relationship with your healthcare provider or PCP as your primary care provider. And so that's important because when you're going in for a checkup or a physical exam, you want to make sure that you know the person that is really taking care of your health, and you want to make sure that you have a good working relationship with them and someone that knows about your health and about your life, and so they can really give you personalized and individualized attention when you come in with the sore back, or maybe you are having some vision changes or something. They know the context of your health history, they know your baseline, they know what your work environment's like, what your home environment's like, and then they can actually make really personalized, individualized recommendations for you. And so it's great to have that relationship from the beginning before you start to have health problems. And so we also want to make sure that when you do have that annual physical exam, that you do have lab work done, that you go in for your routine dental exams and cleanings, usually once to twice a year is what's recommended for good dental care. And then, we typically don't have a lot of people do hearing screens once they're out of the K through 12 environment. You might have a hearing screen depending on your age when you were in elementary school or high school, but typically after that, unless you're having an issue, you don't have a hearing screen. But if you work in a loud environment or you're exposed to loud sounds, maybe you go to a lot of concerts, maybe use heavy equipment or something like that, hearing screens can be really important. If you have age-related hearing loss that typically what we say runs in your family, that may be something that has more of a genetic component to it. And so hearing screens are great for people who are having some difficulty, especially in this time of wearing masks and you're not able to really rely on lip reading. Some people don't realize how much they look at the facial features and the facial expressions in the mouth to actually understand the context of what's being said. And so if you're having more hearing issues and understanding, conversations that are taking place, it may be because you are compensating without realizing it. So a hearing screen might be something that is appropriate for you. And then we say a comprehensive eye exam is important with pupil dilation. So many people will simply go to the local eye store, eyeglasses store, and have an exam done with an optometrist, and that's great. That works wonderful. But But as you start to age, you want to have a comprehensive eye exam, particularly if you have a family history of glaucoma, which is that high ocular pressure, or if you have other, diseases or conditions that would impact your eye health, like diabetes. So you want to make sure that you're having that pupil dilation so that you can look at the vessels in your eye and make sure that those are good and healthy and that they, look like they are functioning well and don't have any, blockages or obstructions or things like that. It's just a great way to know about your eye health. You also want to have your blood pressure and your cholesterol checked, your blood sugar to make sure that you don't have any, level of diabetes, whether it's pre-diabetes or metabolic syndrome or gestational diabetes for those who are expecting. You could also have a baseline EKG, although most people are not going to recommend that unless you do have an ongoing issue or a strong family history. And then I think it's so important that we check on our thyroid health. There are millions of Americans with either hypothyroidism or Hashimoto's, which is an autoimmune-based thyroid issue. And then some who have actually, a hyperthyroid condition. But usually we see hypothyroidism, and there's lots of factors that, play into that. I recently was diagnosed with hypothyroidism, and that has been a complete game changer in terms of my health and wellness and my weight loss journey and just the level of energy that I have and the sleep quality that I have. It's been really amazing, even though I know how important the thyroid is. Until you start taking medications and supplements to support that when you are low in those thyroid hormones, you just don't really understand how much energy you didn't have before. And so I think that's so important to make sure your thyroid is healthy. So much of what is going on in the environment that we're exposed to is in terms of chemicals and xenoestrogens, which are estrogen-like chemicals that we are exposed to in plastics and things like that, can really take a toll on our immune system and particularly our endocrine system. And so that's something to be mindful of as well. And then, of course, immunizations are important. And these are the standard ones that you would want to make sure you have a booster for. So the flu vaccine and tetanus and pneumococcal, so for the pneumonia prevention, and then hepatitis as recommended. Certainly, if you work in healthcare or in the food industry, hepatitis vaccinations are important. And then colorectal cancer screenings for those who are over age 50, or if you're high risk, maybe earlier than that, earlier in your 40s. And then typically a colonoscopy is recommended every 10 years. You also can have something called a fecal occult blood test, which helps to examine whether or not you have any blood in your stool, and that goes along with your colorectal health. And something that we don't talk a lot about, but I think it's important to highlight. Some other things that you want to think about, particularly as these relate to hormones. And so, everything listed here for the screenings are done in that, gender binary. And so just know that if you don't fit into those two categories, that you can, look and think about these as being a hormonal issue, okay? And so whatever is appropriate for you, these are the tests that you would want to look at. And so additional screenings for women would be a clinical breast exam or a monthly self-breast exam. And so if you do have, any pain or tenderness or lumps or masses in your breast, and you notice those on a self-breast exam, then you would want to schedule an appointment to have a clinical breast exam with your healthcare provider. Sometimes it's appropriate to have a mammogram after 40. They typically like to wait until you're in your 40s because younger women tend to have dense breast tissue, meaning that the tissue is so close together that it's difficult for a mammogram to pick up on, lumps or masses or nodules or things like that. Of course, a pelvic exam and a pap smear test for women, checking on the health of that cervix, and then a bone density test as recommended, because we do know that we tend to lose calcium as we age, and so that's important. And we want to go beyond just thinking about drinking milk for calcium, because there are other sources that are a little bit better for you. And we know that milk and gluten and corn can all be really inflammatory, and so we want to think about some other great sources of calcium. And then additional screenings for men, one that's not listed here that I'm going to mention is that breast exam. So men can have breast cancer as well. You have the tissue just like, women have the breast tissue. And so it's important to make sure that you actually do that exam as well. In addition to that, you'd want to do a testicular exam, and that can be done, at home. There's instructions online with a quick Google search. It, pulls up some great recommendations of how to do that. But typically, you're just feeling again to make sure in both areas that there's no lumps, masses, tenderness, pain, anything unusual. And you would want to do that usually after a warm shower is the best for both of those. And then for men, you can just simply pick a day that you would actually do the self-exams. And then for women, we typically say about a week after your menstrual cycle, if you're still experiencing a menstrual cycle, that tends to be the best time and the least painful time for you to do your self-exams. And then also you can have a prostate screening for men. And this is to make sure that you don't have benign prostate hyperplasia. And so this is an important thing that you would have scheduled with your healthcare provider. And so just take this information as needed for, your own health purposes, and just some things to keep in mind as you're, looking at screenings and thinking about your health. So many times, you actually will catch a lump or a mass or a nodule or something, and you're able to go in and get, treatment and care for it. And that's really important because you know your body best and you're the expert on your body. And so, if something doesn't feel right or if something feels different, you're going to recognize that quicker than a healthcare provider would. And so that is really the, goal of this information here, is just to get to know your body and to keep a check on some of these things that may kind of go under the radar for you. Um, Also, with the breast exam, just know that the breast tissue does go up into the armpit area, and so that's called the tail of the breast. And so for younger women, typically younger than 40, but definitely can still happen in the 40s, you can have breast cancer that's actually closer to the underarm area, and that's usually called breast cancer from an inflammatory process or inflammatory breast cancer. And so that can be really important because it won't actually be in the breast itself, but to the side. And so some women and men don't know to check there. So just a tip for you to make sure that you're getting all of those areas covered in your self screens. So some hormonal changes that can happen. We can have, pre and peri and postmenopause. So premenopause is just anyone who is before that hormonal change that starts the menopause cycle. And then peri means around. So that means that you're around the time of starting menopause, which is usually in your 40s or 50s. It can be later, but typically in the US, it is actually a little bit earlier. Around the world, we're usually one of the first populations that experience those hormonal changes that lead to menopause. And a lot of that, again, is our exposures to toxins and xenoestrogens and things like that. And our lifestyle, our eating choices definitely impact that. And then you can be postmenopause. So after that hormonal, change has occurred, then you would be postmenopause. And so to say that you're in menopause, you're typically going to have the result of a no menstrual cycle for a year. And again, the average age is 51 years old, but the range is 45 to 55. And that's about a decade younger than our counterparts around the world. And so, the most stereotypical symptom will be hot flashes. And so we know that can be really uncomfortable. Anyone who lives in Alabama knows about having hot flashes because it is quite warm in July. But you can also have vaginal dryness, mood swings, decreased libido, decreased concentration, so you can kind of really lose your focus easily. You can have insomnia, which is probably really related to that decreased concentration because you're not sleeping well. And part of that is because of the hot flashes, but another part of it is the hormonal changes that really interrupt your body process actually interrupts your sleep cycle as well. You can have hair loss, and you can also have weight gain. So we typically think about hot flashes and weight gain, but the other symptoms we don't talk about as much. You can also have metabolic syndrome, and that puts you at risk for cardiovascular disease, stroke, and blood clots, and type 2 diabetes. And so that's not as common, but I think it is important to mention just so that you're aware if you have those risk factors. Going through the menopausal period of your life may actually increase that risk slightly. And of course, you would want to note any of those risk factors with your healthcare provider, particularly if you're taking birth control pills or a form of estrogen that's a supplemental hormone, because that can lead to an increased risk for you in terms of your cardiovascular health. And so there's some great options there that you can explore with your provider that would help take care of all of the issues and needs that you have without increasing that risk. And then for men, we know that testosterone levels begin to drop. And so they can drop as much as 3% a year beginning around the age of 40. And so it's important to note that, because men, when they have a drop in testosterone, it's not as obvious sometimes that that's what they're experiencing. And so, when you look at decreased libido and hair loss and fatigue and mood changes and loss of muscle mass and increased body fat, these issues with bone mass and memory issues and lack of motivation or depression, elevated hemoglobin A1C, which is your blood sugar being elevated, anemia. You can have erectile dysfunction or changes in your semen production. And so if I were to name all of those things and not tell you that this was about hormone health and not tell you about testosterone, if I named all the rest of that and added some social factors in, you might think that those are some of the things that you associate with a midlife crisis, right? And so it's important to note that sometimes what looks like a midlife crisis in our 40s, which stereotypically we think about it with men, but we definitely have seen, women with struggles and, having some of that, um, need to re-examine life, right? And so we just think about stereotypically, though, it's attributed to men. Then what we're really seeing is not a midlife crisis, but maybe a health crisis, or maybe, just a needing to reset of our health and wellness. And so I would really encourage you, if you start to notice those changes in yourself, not to accept that this is the status quo and that this is expected, but maybe there's something going on with my health, something going on with my body that I can actually do something about and make some really good changes. And so that would be my encouragement to you. And we're going to talk a little bit more about that. So weight loss over 40 can be really tricky and can be hard. It can be challenging. And so there's things that happen within our bodies that make it more challenging. Digestive capability diminishes somewhat, and our metabolism can diminish as well. And then the rate of our cells in our body, the growth rate, will actually decrease. And so all of that combined with lifestyle changes and other factors that go in, hormone health and transitions in our lives. In our 40s, we're thinking about taking care of parents and taking care of kids, and you're probably in the stage of your career where you have more responsibility. And so there's lots on your plate at this point in your life, and so you can have some weight loss resistance as a result. And so here we have the, traditional scale measurements that show you your weight and then how much calorie, intake you should have. So your caloric intake overall for the day, how much activity, and really gives you some, measurements or some metrics to be able to say, how much do I need to be consuming in terms of calories versus how active am I? And, what is my current weight? And this is a great way to kind of get a baseline for where you should be in terms of activity and calories. So there's lots of great information out there, and I'm going to give you some more resources. So wellness basics, this is a slide that I include in most of my presentations for Wellbema, because this is really the foundation of good health wherever you are in your health journey, whether you are a marathon runner or whether or not you really only walk from point A to point B in your day, right? And so sleeping well, aiming for 7 to 8 hours a night, and making sure that those are quality sleep hours, so that you're in a cool and dark room, that it's, quiet, or, maybe you have some background noise, that you're going to bed, around 10 o'clock because our circadian, sleep cycles really like for us to be in bed and asleep by then, because so much of our restorative health actually happens between 10 p.m. and midnight. Staying hydrated, which looks like drinking about half our body weight in ounces a day. So usually a little bit more than 64 ounces for most of us, but usually not more than 100 ounces, because you don't want to hydrate yourselves. You can have some water toxicity if you do that. So you have to really listen to your body and see how much water your body needs. And that's going to change day to day. If you're out hanging out at the pool in the lake or teaching a long class, you're going to need more water that day than if you're, inside, indoors in a cool environment, and you're not talking a lot and you're not having to expend a lot of energy. You're not going to need as much water that day. And then you want to strive for a healthy plate. So you want half of your plate to be veggies. And so eating the rainbow for me is just a reminder that you want your plate to be colorful. So I want you to think about the next time that you eat, how colorful is your plate? And it's probably very beige. And so if your plate is very beige or brown, it's probably because you're eating a lot of proteins and carbohydrates. And so think about, having, more than just green vegetables. You want to have purple and red and yellow and orange. And so make sure that you're eating the whole rainbow of fruits and vegetables, because that's going to make sure that you're getting all of the good nutrients that you need. And even blueberries are really good for us. And so make sure that you're doing that, and kind of take notice of whether your plates are pretty beige. And then make sure you're moving your body every day. And this is moving your body more than what you do on a daily basis. So for me as a nurse, if I work a 12-hour shift, and I work 3 12-hour shifts a week, and that's a pretty typical workload for a nurse, then I still on those days need to move my body more than just what I do at work, because our bodies get used to the level of work that we do. And so the more you move the body, the more that you have to move it, kind of intentionally outside of those work times, so that you are burning those extra calories, because our bodies are great at adjusting and compensating. And so you definitely want to be intentional and work on moving your body intentionally in a mindfully way, so that you're not just, getting in some steps or doing your everyday routine. You also want to think about meditating for 3 to 5 minutes a day. Sometimes when we talk about meditation, people imagine sitting on the floor on a cushion and, being completely free of all thought for, 45 minutes to an hour. And that's not really feasible for most of us. And so what I would encourage you is to sit in your chair or your car when you're parked somewhere and just do a 3 to 5 minute meditation. And you can use an app. There's lots of great apps out there that I like and I can recommend for you. But 3 to 5 minutes has been shown in the literature to be really effective, and everyone has 3 to 5 minutes. And so if you just want to download a free app and start that process, I find that to be really helpful, because it walks you through some guided meditations where you start to learn how to meditate. And meditation is not about being free of thought. It's about letting a thought come into your mind and then letting it go. So that when I think about needing to write, my grocery list down, because some of you probably have something popping into your mind while I'm talking, right? Because we are great at multitasking, or at least our brains want us to multitask. Instead of thinking that I need to kind of pay attention to that voice that says, this is what I need at the grocery store later today, you can actually just let that thought come in. I need to make a list for the grocery store, and let that thought go away, and it doesn't interrupt your thoughts. And so it really is a training of your brain. And it is not the expectation that you are free of thought, because that's not the reality for most of us. So those are the wellness basics. In terms of overcoming weight, management challenges, I would say to really adjust your eating habits. And if you know that you're not hungry early in the morning, but you know that you get hungrier later in the day, maybe you try intermittent fasting under the supervision of your healthcare provider. Maybe it's that you plan for your snacks so that you don't have your blood sugar constantly going up and elevating itself and then kind of crashing. So if you kind of get to that 3 p.m. time frame and you feel drained every day, it's probably because you're having blood sugar spikes. And so you want to make sure that you keep your blood sugar pretty steady, but you don't want to be constantly snacking either. So you need to really journal out how much water works for you, how much sleep works for you, how much snacking and meal planning, how those things work with your body, because we're all different. So that kind of ties into number 3, which is to get to know your body and adjust accordingly, because we all are going to respond differently to different things I recommend here. So I want you to take what works for you and you can just leave the rest. This is like a menu for you to choose from. So just know that whatever calorie intake you have, it needs to be burned off in order to be able to kind of keep that weight at a consistent level. So just eating 100 calories a day can lead to a 9 to 10 pound weight gain over the course of a year if you're not really intentional and mindful about moving your body and exercising. And so those pounds and those calories add up. So I'm not suggesting that it's all calories in, calories out, and move your body. There's definitely other things that go along with it, because you can do all of those things. I did that for years and didn't have good thyroid health. And so I needed that adjustment to be able to make some headway. So there is more to it than just, caloric intake and body movement, but start there. And then if you notice that you don't see a change, then there's something else that you need to explore and potentially have some screenings and some tests done to see, what you can do to really take care of your body the way it needs to be taken care of. You can get, nutritional consults. We have great services here at UA for that. You can also get fitness trainers, which also at the rec center, they have some wonderful trainers that can help you. And so we have a lot of resources you can take advantage of, which is exciting. And then you want to make sure, again, that you're addressing those underlying medical conditions. So, a rough estimate, and this is really conservative, 1 in 5 adults over the age of 40 have a thyroid problem. And really that is growing. I think that that's very much on the conservative end of estimates. You also want to make sure that you're eating those nutrient-rich foods. So making sure you're eating the rainbow, monitoring your calories in and out, avoiding empty calories. So if you do have a snack, eat a good snack and really enjoy it. Don't just, kind of graze, don't graze and snack and then have a lot of empty calories. Go ahead and enjoy. If you're wanting a chocolate chip cookie and you're trying to avoid that because you have labeled that a bad food, quote unquote, maybe you just need to have a healthy version of a chocolate chip cookie and satisfy that need that you're having. Whether it's just an emotional need or maybe it's a caloric need, but go ahead. If your body is designed to crave food, and so a mindful eating approach is to give your body what it needs within reason. And then hydration is very important. Sometimes we think that we're hungry when we're actually just really thirsty. So try drinking a glass of water, 6 to 8 ounces of water before you eat something, and you may find out that you really aren't hungry, you're just thirsty. And your brain sometimes interprets the hunger cues as, and hydration cues as being, a hunger pain, and not really, it's not really a hunger issue, it's really a thirst issue. And then increase your fat burning ability by being able to work your large muscle groups. And so, having your leg muscles working, if you can do leg exercises, that's really helpful because those are the largest muscle groups in your body. And so when they are burning fat, they are burning, muscle fat. All of those things are working together to actually give you some calorie deficits even beyond just the time that you're working out. Your body will continue to burn. As those muscles are developed, it'll burn fat. And so HIIT is called high intensity interval training, and you can do lots of different exercises. There's lots of programs out there. There's HIIT workout apps. There's things like Orange Theory. There's great classes with cardio burns and things at the rec center that include that high intensity cardio training and strength training, which is so good to maintain your bones and your muscle mass throughout your lifespan. And then again, just that daily movement. And sometimes it may just be a dance party in your kitchen while you're cooking dinner. It doesn't have to always be a run or a walk or something that's really planned out. It doesn't have to be a workout program. It could just be that you dance in the kitchen to some music as you know, cook something for supper or for lunch. So just moving your bodies daily is important because our bodies are designed to move every day. And the more fun it is, the more likely you are to do it. So when is the best time of day to work out? I get that question a lot, and everyone is always going to tell you the morning, to get that done first thing in the morning and you'll feel great. For people who are just starting out working, out in an exercise program, I would say probably right after work is the best time, just because you are going to have been done with your day. So if you get really tired out from the exercise or the walking or whatever you're trying, then you've already accomplished what you needed to in your work day. And that kind of can relieve some, pressure. Usually your cortisol level starts to drop off after the afternoon. So if you have a lot of stress or anxiety, you're going to actually feel probably a little bit calmer going into the dinner time hour. And then you're probably going to eat less. You're less likely to snack during the night because you're really starting out your evening routine with a good exercise, whether it's walking or an exercise program. And then, you really can start to adjust that as you become more physically fit and as you start to develop more discipline and healthy habits. And so I started working out in the late afternoon, early evening, right before dinner. And that helped me a lot because I struggle with inflammation and autoimmune, like I mentioned. And so working out in the morning when my cortisol level, that stress hormone, is so high, was actually really difficult for my particular body. My body did not respond well to that. But sometimes we don't exercise because we can't be perfect. And so for years, I said, well, I just can't work out in the morning, as if that were the only time of day that I could work out. And so I had to do some mindset work and remember, I can go for a walk. And that's what I started with, walking after work before dinner. And so that could be with kids or grandkids or pets, and make it fun. And then gradually increase what you're doing for exercise. You also want to make sure it's the time of day when you feel most motivated and energized. And I'm a night owl. I'm not an early bird. And so that's really helpful for me. You also want to schedule your exercise as if it's a meeting with yourself. So if someone comes and interrupts you, and you're likely to say, "Oh, well, I can just walk later. It's okay. I don't have to do that right now." If you take that approach, then you probably won't get to work out very much. So make an appointment with yourself and keep it just like you had an appointment or a meeting with someone else. And that's the way that you're actually going to be able to move forward with your health goals, is because you've got to learn to set healthy boundaries and prioritize your health and well-being. And, no one else has to know if that appointment is with yourself to walk or to exercise. But it's important because that builds your self-confidence and your self-trust, that when you say that you're going to do something, you're going to follow through. And your body starts to really trust and respond when we treat it well like that. And then you definitely want to avoid the all or nothing thinking when it comes to exercise, because we can get into that trap of, if I can't do it perfect or if I can't do an entire workout, I'm not going to do anything. But, dancing for 10 minutes in the kitchen at supper time is better than not doing any kind of movement. Doing 15 minutes of stretching before work is better than not doing any kind of movement. So I'm really passionate about making fitness accessible for everybody. And every, fitness level, because we all start out as beginners. And some other things, walking is really low impact and it's easy. It doesn't cost anything. Most of us have a pair of shoes that we can, pretty easily put on and go for a walk around the neighborhood. And so it does help with so many things, but digestion. So a walk after dinner could be really helpful if that's good for you. But it also helps, with building that good, strong bone and muscle and all of the foundation that you need to start exercising, more intensely later, if that's something you choose to do. So some things to remember, again, you want to just stretch everything before you get started with walking or an exercise routine, because if you haven't been exercising or moving a lot and then you start out, a lot of people will have muscle pulls or strains. And so you want to make sure that you're actually stretching really well before you start. Use all of your muscles. So, advanced workout, exercise enthusiasts will actually have days dedicated to legs or upper body. Don't do that to yourself as a beginner. Do something like walking, running, light cardio, yoga, something like that that's going to stretch and work out all aspects of the body in one, 20 or 30-minute workout. And then as you become more advanced, you can have, cardio days and upper body days, but don't start out with that. And then vary your routine. So you want to make sure, because again, our bodies get so used to accommodating, right? They want to take care of us, so they really adjust well. You want to make sure that you're actually changing up your routine so that your body doesn't get used to a workout. So I listed some options here, but these are all great entry level, new beginner to exercise program classes that you can do, or exercises that you can do that are really, inclusive and accessible to people who may not have worked out a lot in the past, or maybe it's been a while. And then you want to make sure that you pace yourself. So your workout intensity and duration, just remember that you push yourself to your limit, and that may not be someone else's limit. So, you work yourself, you push yourself to what you can, reasonably sustain, and then that's your best, and that's good enough. That's your starting point. So some more good tips, again, just kind of know your family history, especially as you start to get older and family members are not as accessible. You want to make sure you know your family history and what you're at risk for. Again, eating those good, fresh, organic foods as much as possible. You can look at the, dirty dozen of foods that you want to avoid because they have more pesticides and aren't as clean. Limit alcohol consumption, of course, limit or avoid tobacco and vaping products, because those can be really harmful, especially to our circulatory system, our hearts, and our lungs. Find something that you enjoy to do for exercise. Try to avoid fad diets. The latest research shows that people who diet actually end up gaining more weight over the course of their life than people who don't diet, who are still overweight. And so the more that we diet, the more that we're training our body that we're not getting enough food, and it's because we're limiting it. So there's a lot that could be a class unto itself, but just know that fad diets are really harmful in the end to your body. So just try to focus on what I call JERF. It's just eat real food. So just eat real food, JERF. That is a really great principle for you as you're thinking about making healthy, eating choices and food choices. That will be a really great, way to get started in terms of nutrition. And then just commit to yourself and to commit to your, your healthy living choices, and make incremental changes as you go. So just take one or two things to change. And once those become habits, then you can change other aspects of your fitness and lifestyle journey. So always begin with one or two things. And then this is a great 40 after 40 healthy habits list. And so, starting with that life audit and evaluating your habits and changes that you need to make, prioritizing, preventive health measures. You can print this off and use it like a checklist. I actually have this listed in our latest blog post, which I'll tell you about. And so this is just a fun kind of bucket list of 40 things to do after 40 for your health. And I think for someone who loves lists like I do, I think this is a great way for you to print this out, put it on your fridge, and start checking these off in terms of finding good goals and getting started with a healthy habit. So some other special considerations I just want to mention. I mentioned at the beginning of the presentation about, caregiving and the role that you have as, a person in your midlife. And you really can end up being the sandwich generation, where you are also taking care of work responsibilities, maybe young children or college-age children, and possibly parents. And so you can really feel like you're pulled in multiple directions. And so I just want to acknowledge that if you are a caregiver in that sense, that it can be more challenging to take care of your health and your well-being, but it is possible. You're just going to need to be more intentional about how you plan and about asking for help. So a lot of us don't like to ask for help, but I think now more than ever, we're realizing that we are designed to live in community with one another. And we do have, systems and structure in place to be able to support us and to live, really, good, healthy lives. And that revolves around having these relationships and friendships and these support systems. And so if you don't have that right now, maybe that's something that you want to consider building as you know, move forward the rest of the year. Building that great support network for yourself, and that will be a source of encouragement and practical help when you need it. So pain management, we mentioned some of the things about muscles and joints and bones, and we're all sitting a lot more now that we're at our desk at home, probably for most of us. And so just know your limits and know that when you need to lift or push or pull something heavy, that you ask for help. Make sure that you're stretching and doing your exercises and daily movement. And then if you do hurt something, go ahead and reach out to a healthcare provider pretty quickly so that you don't have something, you know, that develops later because you didn't, you know, really attend to or address the issue or injury. You can try the RICE method, which is, you know, the rest, ice, compression, and elevation, especially if it's like a leg or an arm. And then, of course, you can use over-the-counter pain medications and essential oils and, you know, creams and things that have, you know, that medicated you know, pain relief or pain analgesic. So those are all things that you can do to really support pain management, but it's important that you don't let those injuries and that lack of, you know, pain management cause you to not exercise or move your body. So then inflammation and gut health is really important. You want to make sure that, you know, your inflammation isn't causing other issues in your body. If you have a lot of stomach pains, or if you have a lot of food allergies, or you're sensitive to, you know, toxins and things, it could be a gut health issue. And that is so much, you know, a part of our, you know, culture and dynamic now in terms of having to really think about healthy foods for our GI tracts and limiting inflammation. So there's so much information that could be said about this. This is a resource, Dr. Amy Myers, MD.com. So she's got some great resources for you there, but that may be something that you want to explore if you're having some issues with inflammation or just allergies or just not feeling well. And then eye health is important. We mentioned needing the eye exam where they actually, you know, dilate your pupils and check those vessels, but make sure that you're wearing your reading glasses. I notice I'm having a lot of eye strain. Y'all may be too. So you may want to get some artificial tears to take care of our eyes now that we're doing a lot of computer work, a lot of Zoom calls. Make sure you're using your reading glasses. Make sure that, you know, you're protecting your eyes from the sun when you're outside. Have some sunglasses on with UV protection. Make sure you're wearing safety glasses and goggles and things when you need to. Avoid that eye strain. So you want to make sure that about every 20 minutes you look up and away, about 20 feet away, which in offices and homes you may not be able to do that, but make sure that you're just looking up frequently from computers and technology. Protect your eyes from blue light exposure. So you can get glasses that will help with that. And you can actually use settings on your phones and devices to take some of that blue light away. And then again, get that annual exam. And then sun exposure. You want to make sure that you're using UAV and UVB protection. And so make sure that you're actually protecting your eyes. Make sure that you are applying sunscreen frequently to sun exposed skin areas. And you want to make sure that you get about 15 to 20 minutes of sunshine so that you can have some good vitamin D production. But then after that, you want to make sure that you're applying your sunscreen frequently, and that especially if you're getting into the water, that you're reapplying frequently because it will get diluted or washed off. And then we know that avoiding the sun between 10 a.m. and 2 p.m. when the sun rays are the most, you know, kind of powerful in our area is really helpful for avoiding skin, you know, burns and sunburn. So definitely do regular skin checks for areas of concerns, and you can actually check your moles. There's a method called the ABCDE method, and a quick Google search will show you, but it talks about, you know, asymmetry and border and color and kind of diameter or size change, and then elevation. You know, if your mole is elevated, that's more of a risk factor. It doesn't always mean that you have something going on, but if it starts to elevate, that can be an issue. And so making sure that you have those good skin checks is important. And this is the ABCDs. You can also use E for evolution, so if it changes. So this is just a great kind of screening tool that you can do at home. But of course, if you have concerns, you can reach out to your healthcare provider or a dermatologist. And I see a question. Mark, do you have a question? You're welcome to unmute if you do, or you can post it in the chat. And then you also are more at risk for getting shingles as you age. And so that's usually due to a stress response, typically over age 50 or so, because our immune systems can weaken. And so you can end up with more of a risk factor for developing shingles, even if you've had the chickenpox vaccines, which most of you probably haven't. I haven't had that. Or if you've had chickenpox in the past, that virus can come back as shingles during times of stress or when your immune system is weakened. So of course that would be important in the terms of the context right now. With the pandemic, there is extra stress, so that's something to be aware of as well. And this is what it looks like. It's typically on the back area of, your kind of trunk with, your shoulder blades kind of in that area. For ladies, this is kind of where a sports bra would come down kind of around your sides. And it looks like psoriasis, but it's usually a little bit more red, and it's really painful. You can have nerve pain with it. And then mental health. We want to just make sure that, if you're feeling unusually sad or angry or overwhelmed or just not yourself, if you're, having unhealthy coping mechanisms like overeating or, indulging in other substances, or you've had an extra loss in your life beyond just, what has happened during the last few months. Maybe it's the loss of a loved one or a relationship, or something that's important to you, an activity, or something that has gone away because of the last few months, or you've had a recent trauma or life event, or maybe something that's been triggered that happened in the past. All of those things can be really detrimental to our overall health and well-being. And so we want to make sure that you kind of think about those things as you reflect and pause and reset, that you're reaching out to the help. And we've got some great mental health resources through the University of Alabama, and some great resources in the Tuscaloosa community. So definitely let us know if this is helpful to you, if you'd like to know more. And of course, if you stop enjoying things that you normally enjoy, and past coping strategies haven't helped you, then you may want to look at the American Behavioral Resources and set up an appointment with your healthcare provider, or with the appropriate people that can help you with your mental well-being. And then habit change. All of this really, that's been recommended today is really about having sustainable long-term weight loss or health changes. And so we want you to know that slow progress is still progress, and that, really habit change is going to be the thing that helps catalyze and kind of pull you forward into this, new way of lifestyle. And, it's going to be the thing that helps sustain you when you lack motivation. You need the discipline that's developed through habit change, because motivation is going to come and go. So some upcoming classes that we have are listed here for you, and I'm going to go to the chat in just a second and answer your questions. So we'd love for you to join us about the mental health challenges, and we are going to talk about tips in transitioning back to work and school, because I know that's probably weighing heavily on some of your minds. And then August 29th, we're going to talk about diabetes, the sweet truth, and we're going to talk about how to manage that really well. And then these are all of the ways that you can follow us through Wellbama and Wellness and Work Life. And so we recently added, under the direction of Miss Carolyn Vicker, who's on the call today, she has put together this great blog for us. And so for each class, I write a blog post that accompanies it. So it's going to have some extra resources and things for you. So we'd love for you to check that out, and you can grab the additional resources and the 40 after 40 checklist. And then we're going to take questions, but we also have health and life coaching available with me that's free. So if you're interested in that, it's a 30-minute appointment that we can set up at a time that works for you, and we can do a traditional phone call, or we can do a Zoom call and start looking at some of your health and wellness goals, and I can help support you and direct you to resources. So if you're interested in that, you're welcome to reach out. So let's go to the chat and see what questions we have. So getting away from milk, what are some good calcium options? Okay, awesome. And then Carolyn is saying that The Wellbeing screenings will begin on August 18th at CCN. So they're going to have free flu shots at the screenings. And so you can have registration beforehand, and that opens on August 1st. That's great. And you didn't get the blog website. Okay, I can go back to that, and then we'll get Mark's question. Let me go back to that. There you go. So good sources of calcium. You can have things like leafy green vegetables are good sources. You know, when you think about having calcium, you also want to think about having potassium and magnesium. And so anything that's going to have those, for me, what I do is I have spinach and blueberries and pumpkin seeds. And that's a way for me to get in the calcium and magnesium and potassium. And so one thing that you could do is a shake in the morning. So, you know, an at-home smoothie that you put together. Find a recipe that has your favorite sources of those things, and then you can put them in a shake. So a green smoothie could have the spinach and, you know, oranges and, you know, almond milk is something I typically use. Combined with pumpkin seeds, you can either eat them as a snack or you can put them in your smoothie if you don't enjoy the way they taste. And then some blueberries, and that is going to get a good serving of the fruits and vegetables and the minerals and vitamins that you need in one serving for like a breakfast shake. And that's typically what I do. And if those don't sound good to you, if you do a simple Google search, you can type in fruits and vegetables plus whatever, you know, magnesium, potassium, calcium that you want to get, and it'll give you a list of all of the sources of that. And of course, you want to try to get things that are naturally occurring with those vitamins and minerals, not fortified foods. So you can get those things from cereal, but you don't want to get those, you know, from cereal if you can get them from fruits and vegetables. So, okay. That's the same question. Let me go to the chat. Shelly says, thanks. Mark says, thanks. Good. I'm glad that helped, Mark. Do y'all have any other questions or anything else that y'all want some clarification on? That was a lot of information, but I hope that some of that was helpful takeaways and will give you some good ideas of where to get started. I always like to remind people that you just want to pick one or two things and start there. And if you can start with adding the good stuff in and, you know, just adding a shake for breakfast or adding in some daily movement and adding in those good habits. We like to add things to our you know, to our lives. We don't necessarily like to take things away. We don't necessarily like subtraction. And so if you have a daily habit of getting a Coke on your way home from work, you know, taking that away is going to be really hard, especially while we're trying to comfort ourselves right now and while we're trying to adjust to so much. So instead of taking away that, you know, quote unquote bad habit, if you can just add in the good habit of, you know, I might stop and get that Coke on the way home, but after dinner, I'm going to go for a walk, and start adding in more things, eventually it will crowd the quote unquote bad stuff out. And so that is what I think leads to long-term sustainable change, is just adding in the good stuff. And then you're eventually naturally not going to want to stop and get that Coke, or not going to want to, you know, smoke the cigarette, or, you know, whatever it is for you. I think that's so important to focus on that, because when we try to do everything, that's when we start to see, you know, our energy and our motivation and our discipline kind of go. So all rec exercise classes are virtual now, correct? Carolyn, can you pop in? Do you know if that's the case? I'm not 100% sure. I do at-home workouts, but if I didn't, I would love to do the rec classes because they have some great offerings. We'll see if Carolyn's able to answer. Carolyn had some connection issues. She's going to check. Okay, do we have some other questions while we give Carolyn time to check? And thank you for doing that, Carolyn. Group exercises online. Yeah, and there are a lot of great ways to exercise. If that's not something that that is something that you want to do, again, start with walking. There are some great activities online that you can do, you know, yoga classes and things that you can do online. And Yoga by Adrienne is a great resource for beginners who want to try yoga. Walking is free. You can do apps. There's lots of great apps that have some exercises. I've used one called Burn by Rebecca Louise, and she's great for a beginner, and it's like $4.99 a month, and she gives you HIIT workouts and yoga classes. So that's a great one. I mean, it's just one I've used. No personal connection, but it's one that I know that I don't mind recommending because you can modify as you need to. Carolyn said that they are live streaming those on Facebook, so that's great. So I had another question in the Q&A. I don't know that you can see it, but it just talks about what's a good, safe way to detox. So detoxing is very controversial because a lot of medical professionals are going to tell you that, your liver and kidneys and your body is really designed to detox on its own. So what I will say is if you want to support your body's, way of detoxing, drinking that water, that, 64 ounces to, however much works for your body. Water is a great way to start. Sleep is a great way to start because if your body is tired, it's not going to be able to detox. It's not going to have the energy and the rest and the restoration that it needs to be able to work properly. So start with those wellness basics, the sleep, the hydration, the movement, the meditation, the nutrition. Add in things like the vegetables and the fruits. Cilantro is really great at helping your body naturally detox from things. So when you make tacos this week, put some cilantro on them. When you make your smoothie shake that I mentioned, put some cilantro in it. Pumpkin seeds are really great for detoxing and helping with things like gut health. So there's a lot of research out there about that. If you want to do a quick Google search, you can get tons of information on what all pumpkin seeds help with. I added those in recently, the last few months, and I've seen really good benefits from those. It's a good source of magnesium. It's a good source of salt if you have some low blood pressure issues and you kind of are lower on salt, which I tend to be. It's great for that as well. Those are the places I would start. And then things like infrared saunas can be really helpful for actually detoxing. And there's a lot of great, benefit to those. And not much controversy, but you definitely want to make sure that if you have major, diseases like diabetes, blood pressure issues, cardiovascular issues, anything like that that's major, you want to make sure that you're cleared with your doctor because infrared saunas does raise your blood pressure and your temperature and things while you're in there. So for people who, don't have those types of issues, it's still appropriate to check with your healthcare provider before you try those kinds of things. But that's one way. And that's why exercise is so helpful too, because when you're exercising, it's not just moving your body, but you're sweating out the toxins that your skin is naturally going to expel. So when you do exercise or you're outside and you're sweating a good bit, make sure you come in and wash that off so that the body doesn't reabsorb it back into the skin. All right, good, Mark. I'm glad that that was helpful. Well, all right. If there aren't any other questions, then we'll go ahead and wrap up for today. But I'm really excited for y'all. I hope that y'all are able to pick one or two things this week to start thinking about implementing and adding into your lives. And just remember to take it one step at a time, and slow progress is still slow, still progress regardless. So just make sure that you take it slow and steady and stay encouraged. So all right, we'll go ahead and wrap up for today, but thank y'all so much. Have a good one.